Are you an expecting mother who is suffering with back pain? Well, stick around because in this short video, we're going to give you some safe and simple tips to help you with a pain-free pregnancy. So today we have Desiree with us. Desiree, how many weeks pregnant are you right now?
24.
24. Wow. And then is this your first or your second?
Second.
Second. So understanding why you might have more pain at this time is also important to getting rid of that pain and having a more comfortable pregnancy. Reason number one, you're carrying more weight, but this also creates problems of more edema, which can create less space for nerve and joint tissue, causing more compression, more pain, and causing ailments like carpal tunnel syndrome, which we can talk about in another video. The second reason has more to do with postural changes in your body. As the baby grows bigger, so too does your abdominal wall, which creates a lengthening, and by virtue, the antagonist, the lumbar muscles, paraspinal muscles, become shorter and tighter. This also creates a weakness in your glutes, which play a huge role in the stability of your pelvis, your low back. That pelvic tilt instability creates a lot of pressure on the joints and a lot of back pain. Reason number three has more to do with hormones than anything. In order to get ready for labor and delivery, your body actually has to change the laxity of the ligaments with a hormone called relaxin. And that hormone also is a great thing for preparing for labor and delivery. It's a terrible thing for pelvic stability, predisposing you for much more back pain. The last reason why you're having more pain is because a lot of the more common general recommendations from your medical doctor, like take a painkiller, are not necessarily a great option if you're pregnant while you're trying to keep your baby safe from toxins. So the first thing we want to do is make sure we neutralize that tilted pelvis, which will take pressure off the discs and the joints of the low back, taking stress off the musculature. So the first step we're going to do is put the left foot in front of the right foot so that you're 1 foot distance away. This is where you're going to start your wall stance. So then you put your right foot next to it and you're going to go hip width apart. And now all your weight is going against the wall here. So secondly, we're going to go to the knees. We're going to bend those, not into a full wall squat, but we want to do it so that we cannot see our feet. This is so that we're putting very minimal pressure in the knees and maximizing the stress we're taking off of the joints of the low back. And then the third phase, you'll see Desiree is doing a really good job already. This is a lot harder than it looks, to flatten her low back. So her pelvis is tilting backwards, okay, or we have pelvic flexion is what it's called. And from this position, we hold it for a solid minute. Now, to intensify it or further stabilize, we take a foam roller and we're going to put it right between the knees, and then we're going to engage or squeeze the knees together, engaging the adductor muscles, which will fully stabilize the pelvis and take a lot of pressure off that back pain. People typically tend to overarch their low back, dropping their tummy down. So it's really important you neutralize it first, just like you're on doing your wall stance. From here, what we're going to do is engage these little muscles that stabilize the pelvis to the spine, called the quadratus lumborum, or the QL. And the way that we do this is just simply by lifting up the knee 1 inch into the air. So again, the neck is neutralized, and we're going to lift that knee up 1 inch off the ground. That's really it. You only need 1 inch to engage that QL and opposite firing muscles. Now, to intensify this, if this is working really well and it's super easy, then the opposite arm will lift up 1 inch, twisting the spine the opposite direction as the pelvis. And you'll notice this is way more difficult to balance, which is really important for engaging all those postural muscles, keeping your back strong through pregnancy. Very safe on the tummy and the baby. It's very challenging, and it is technically a postural muscle, so we want to try to hold this for a good 30 seconds and maybe do a couple reps on each side. Try those exercises every day. The earlier you start in pregnancy, the better. However, it's not too late if you're 36-week pregnancy. These are very safe things you can do. If you find these even just a little bit helpful, you might also be interested by this. Mothers-to-be who are under chiropractic care through their pregnancy, on average, had a shorter labor time of 25% in their first pregnancy, up to 33% in their second and third pregnancy. Most people are pretty excited to hear about that.